Thank you, commissioners, for having me, and thank you for your motion to instruct us to do this work. In January, POC staff formally began this survey to understand kind of the universe of substance abuse-focused programming and interventions that are currently available in probation's facilities. I've been monitoring patterns of these programs and services for months now on a little bit more of an informal basis, basically really prompted by the understanding that we are facing a public health emergency in the county of Los Angeles. We know that we lost a young person, Brian Diaz, within the last year. And recently, I've come across research that's showed us that LA County is currently number 2 in the nation in adolescent opioid-related deaths. So we are certainly in a crisis in our facilities and in the communities that we live in. So all of this work has been conducted in pairs, including myself as the one fixture. And then I have been joined by Probation Oversight Commission staff, a commissioner, and also colleagues from Office of Child Protection and Office of Inspector General. So the process of the work is that we've been looking at probation's programs and services calendars, and then we show up to the facilities. Oh, specifically the facilities we've been looking at are Los Padrinos, Barry J. Nidorf, and Dorothy Kirby Center. Because if you look at the numbers of the population, that's really where the majority of our young people are. So that's where the majority of services should be delivered. We've been showing up to those facilities at a rate of about once or twice a week to observe the programs. We interview young people that have participated, and we interview the providers. We also interview probation officers. And we also take some time to talk to the young people who choose not to participate, because we want to have a deeper understanding of what any barriers that are happening, why they opt out. So after monitoring these calendars for some months now, we've seen that the majority of substance-focused services are being provided by the Department of Mental Health and Tarzana Treatment Centers. Tarzana is functioning under a contract with DPH SAPSEED, Department of Public Health, Substance Abuse Prevention and Control. DMH calls their group services psychotherapy groups, so I just want to be clear that I'm including that in what I'm talking about here. So since January, we have tried to observe 11 different sessions of substance programming at these 3 facilities, and of those 11, just 5 have actually occurred. We've taken a lot of care to allow for the flexibility that we think sometimes needs to be exercised in the facilities, like if somebody's going to show up late to do the program, or if things need to get rescheduled, right? So we've taken the care to show up early to units. We wait around when no one has showed, and we sometimes take the time to walk the whole facility and come back an hour or 2 later and see if anything has occurred or been rescheduled. But we're not finding that that's what's happening. So despite these numbers, the 5 out of 11, I still have to remark that this is better than what I was seeing in visits in November and December, when I was, just doing auditing of the calendars without observation. I've provided feedback to the superintendents of both Los Padrinos and Barry J. They have both provided some actionable steps about what they're doing to make this right. And I can say that I have seen, even just as of this week, that at Barry J. Nidorf, they are pulling out all the stops to try to get those calendars right and trying to align, through multiple revisions and trying to have communication with their partners. They're really trying to get right what's written on that calendar to the reality of what is occurring in the units. So during the visits, in addition to observing any programming, we're also asking about officers carrying Narcan. That's also been a huge improvement very recently, and I especially want to shout it out for Los Padrinos. Most officers have it on them. I'm also following up with young people to ask them about Narcan. So a lot of young people have mentioned to me at this point that they would be very interested and open in being trained on how to administer that. Some of whom have remarked that they have an interest because they have seen within the facilities somebody overdosing. They have seen it in their communities, and some young people also remark that they just like to have a skill that might possibly save somebody they love in the future. Um, DPH SAPSI has been conducting some trainings within both Barry J and Los Padrinos, but those have been happening on really small scale kind of events. So not everybody has been trained. We've still got a ways to go there. I've also been inquiring about the availability of medication-assisted treatment for young people at these facilities. On Tuesday, I actually heard some very good news about juvenile court health services doctor on who's visiting. They visit the units and talk to young people. And it was remarked to me by a probation officer that he had overheard on multiple occasions that this doctor was having some really open, non-shaming, non-judgmental kind of conversations with young people and just openly offering them and making them aware of the full scope of treatments available to them during their incarceration. So in all, I think that these 5 observations is a pretty small sample yet to draw too many conclusions about how well what's being provided is working or not working for young people. So the plan for now is to simply continue these observations and then, of course, to come back and report back to you and provide some written report as well in the coming months. So
Thank you, Dr. Gongora.
thank you.
Before we go to public comment, commissioners, any questions or statements?
I did. One, thank you for the work that you're doing on this. I wanted to ask how the parents, as far as you know, how are they being educated on the treatment options available to the young people?
I don't have a lot of awareness of that. So one of the questions that we have been asking the providers or the clinicians or whoever's providing is, is there any aspect of this program that includes speaking to the participants' families? And we also ask about if there's any discussion about follow-up when a youth is released. And so far, the consistent answer to that has been no.
Commissioner Kokani?
Just one question about the 5, I guess, sessions or groups that you did observe.
Sure.
Were those being administered by DMH or the Tarzana Treatment Center people?
Both.
Okay.
Both. I think we observed 1 Tarzana and 4 DMH.
And there's no understanding as to why the other 6 kind of sessions groups did not occur?
There have been some reports offered both by probation officers and other probation leadership that we've talked about, some of which is it could be a simple lack of coordination and communication between partners. We have had reports that there have been last-minute cancellations. We have been informed that some people believe that certain things on the calendars have been in the past placeholders, just something that's put there and hasn't been acted upon. Those are some specific things that I've also talked about with those superintendents. And I have to say, for the month of March, we have largely seen, as I've said, the calendars have looked like they've been made more accurate, which in a lot of ways means it looks like less is being provided in the way of substance abuse group programming. And I really want to specify group programming because I do believe that both Tarzana and the Department of Mental Health are really effectively doing individual treatment, but it seems like group is the weak point.